It is the ultimate procedure for turning back the clock, helping you look 10 to 15 years younger. We're talking about the facelift, and it was one of the most popular plastic surgeries last year around the country. Dr. Stephen Hopping joins us this morning with who is a good candidate for this procedure and how to avoid looking too stretched, too tight, and maybe doing it at too early an age. Could that be an issue?
Absolutely, Barbara. According to the American Society of Plastic Surgery, this is the 5th most popular procedure for 2011, up 5% from 2010. 120,000 facelifts. People want to look younger. They're living longer, they're working longer, they want to look vital.
So describe a traditional facelift for us, and I assume that they're still doing the traditional facelift. Right?
Very few. The traditional facelift was pull, pull, pull. You just pulled it tight. Modern facelifting is less about pulling, more about filling and pulling. So it looks a lot more natural because some of aging is gravity, but an equal amount is atrophy. So we need to fill and then we lift. Looks more natural, lasts longer.
Now when you say fill, are you using that's a very interesting
there's a good
after,
example. So you see filling the cheeks in the chin. We're going to talk about chin implants, how popular, because it adds bone structure, it adds volume.
So you can't make this happen just by lifting. You've got
lifting won't do it, and matter of fact, lifting looks done. This looks more natural. There's a good example: chin, cheeks, minimal lifting. And will the filling that you put in last as long as the lifting will last? Well, these are implants, so they last forever. But fat will last the longest. It's the gold standard. But no, sometimes people need to come back in for maintenance filling.
And what kind of implants are we talking about when you're talking about lifting with implants?
They're made of soft silicone rubber.
And where do you put those?
Cheeks, chin.
We want to talk about the chin implant because we just got word recently that that has become the fastest growing plastic surgery trend, that a lot of people are getting chin implants. Who and why?
Well, men particularly. Men look better with stronger chins. They did one study, they checked all the CEOs of the Fortune 500 companies, and 80% of them had strong, chins. So it's a sign of strength and masculinity for men. But for women too, it gives a better neckline, it gives a better bone structure, it lasts forever, it's reversible if your patients don't like it, and it's easy to do.
And does it provide any kind of lift in the neck area?
Absolutely. It helps contour the neck. It occupies additional space. Who are the people who age the best? Those people who have great cheeks and great chins.
And at what age would you recommend a chin implant for someone? I mean, at what age can you identify that somebody needs one?
Well, actually, a fair number of young people having rhinoplasty, age 16, 17, 18, also need chin augmentation at that age. So you can do it very young, but I would say we do it with 30% of our facelifts.
And with the age for facelifts, what do you recommend for that?
Well, you ask, is 40 too young? Yes, I think 40 is too young for a facelift. You should do the fillers, all these minimal invasive things that we have. And the whole paradigm shift is not to wait till we get older and have to have a big facelift, but to extend our youthfulness with these more minor things, minimally invasive things. And then we can do a softer lift, the S-lift I refer to, which gives you a softer look, is it combined with fillers. So it's a much better result than what was here even 10 years ago.
Well, great to hear about all this. As always, we're very happy to have you with us and look forward to seeing you again.
Always a pleasure.
Dr. Stephen Hopping, thanks for coming.